What's up, everybody? Connor here, reporting to you live on Saturday. Sorry, this is late. Um, so, um, break it down for you real quick. I am at Cora in Ponte Vedra. So far, everything's been going really well. Waking up at 5:30, getting coffee made, getting breakfast made, getting to work on time, usually before everybody else. No big deal, I'm prompt as ever. Um, so it's been great. Actually, on the first day, they offered me a job before the end of the day. We're getting along. The people that I'm working with, they're really nice and really cool, and the place is pretty big and colorful, which I like because the last clinical that I did was a little smaller and a little more dreary. Um, and yeah, we do like daily trivia question to keep the patients engaged and to give ourselves a little something fun to do. Um, I've done a bunch of manual, done some passive range of motion, a lot of reassessments, progress notes. So passive range of motion, muscle testing, a couple of special tests. Only really had to ask about a few, which I don't remember if we went over or not, like the scour test. Pretty interesting one. It's basically just like a actually inferior, I think, inferior glide of the hip to see if there's some hip pathology. If there's some sort of pain, then it's probably positive. If it's catching or if it's not the right end feel, maybe it's positive. I got to look a little bit more into that one. Scorer, I think. So it's been good. We went to get lunch on Friday. Went to Sun Deli, had some subs. That was good. Um, it's just a PT, a PTA, and the desk lady there. So, small knit, tight knit team. I think the most patients that we had in a day was like 32 or maybe a few more. And there have been times where I've worked with two patients in an hour and getting the notes done. Definitely feeling pretty good about the notes nowadays, but progress notes are a little bit more difficult. Definitely something I need to work on. The assessment portion of progress notes. And yeah, Cora has their own like documentation uh, platform, which I actually like. Definitely easier to navigate than Raintree, which we used at H2. Um, so it's been pretty good getting the hang of that. Um, yeah, and everybody's nice, making rapport with the patients, developing some different exercises for them. I think that's definitely still one thing that I could work on is trying to figure out the best way to keep progressing patients, keep things interesting, and, not overdo it, not underdo it, and just feel confident in those decisions that I'm making for each uh, exercise for each patient. So a little more research to do. Definitely the most interesting patient that I've worked with so far has been, uh, well, I haven't even really worked with him. I've just been watching him be worked with, but just this like 30 something year old guy who went from being completely normal and having no health issues at all to just overnight one night, like started getting muscle spasms, lost control in his legs. Like he's still up and walking and moving, but he like moans super loud when he breathes, like doesn't have control over his esophagus, or not his esophagus, but his epiglottis. Um, so super interesting case, and I've been like researching a lot to try and figure out what it could be. They say it's like long-term Lyme's disease, but severe long-term Lyme's disease or something like that, but doesn't seem to match up. So, and then like the doctor of PT would like pull on his chin here, and the vagus nerve runs around through here somewhere. And when she would do that, he would like stop moaning and making that sound as much when he was breathing. So that was interesting to see that come together. But yeah, all in all, going good. Cora's cool. Amy, my clinical instructor, is nice and being really helpful, and the doctor, Andrea, is super cool. So also very helpful, and they're giving me a lot of responsibility and they're trusting me, and it seems like things are working out so far. So all thumbs up here. Hope y'all are doing good, and let's get after it this next week. Power through.